now we're going to get into the forms of magnesium, and this is a popular question that I get all the time, and we could actually do a full hour on all the forms of magnesium, but we're not going to. Because there's lots of magnesium forms and they all come with their own strengths and weaknesses. So what we're going to do is cover the most common ones today that have the most research and that I often use in practice and that are readily available. The other thing is with a lot of these forms of magnesium, they're not readily available to the general public. So we're going to touch on those today. Now we're going to start with a couple that I just want to say some things about so that we don't buy the wrong form of magnesium. So the first, magnesium hydroxide, we find this in antacids or over-the-counter laxatives, has very poor bioavailability, and it's considered to be one of the most least optimal forms to use as a supplement. So I highly recommend do not choose this as the choice of magnesium. I have had patients that have come in and had antacids thinking they are getting magnesium. So we're not absorbing this. This is not a form that I would recommend. Magnesium oxide, it also is a poor source of magnesium when it's on its own. So they sell magnesium oxide on its own, and it is a laxative. It's a very strong one. It's inexpensive, and that's why they use it so widely. You will often find these in pharmacies, and it's insoluble in water, so that makes its bioavailability less than 5%. So we see side effects that include, of course, frequent digestive upset, diarrhea, loose stools, nausea. So on its own, I would avoid this supplement. Now, we do see magnesium oxide in formula. So we see forms of magnesium, maybe 4 or 5 different forms of magnesium that are in formulas. And they will put magnesium oxide in that formula to buffer. And that is okay because it actually allows for more magnesium to be put into the formula, because the oxide molecule is actually smaller than a lot of the amino acid molecules. So they are going to be able to put more magnesium into that. Now, if you have a suspicion that maybe there is more oxide than any of the other forms in the formula, then it's always important to contact the manufacturer and or the distributor and find out how much is actually in those formulas, because we definitely do not want 95% of the magnesium being oxide and the rest being, all the other forms. So that is something just to keep in mind. But you will see it in formulas, and you will also see it in the buffered bisglycinate. They put it in there because, again, they're buffering it and they're able to get more magnesium into the capsule. All right, magnesium citrate. So this was the popular form of magnesium before bisglycinate or glycinate came onto the scene. And it's a commonly used form of magnesium. It has good bioavailability, especially compared to oxide on its own. We use it to support digestion, specifically constipation, acid reflux, and migraines. Now, because citrate is not actively absorbed like an amino acid, and this is why when we get into the amino acid magnesiums, they don't often cause loose stool, because the amino acid actually helps to not cause the water to get into the small intestine. So citrate actually brings water into the small intestine, and then of course that's going to cause loose stools or digestive upset at higher doses. So what I like to do with magnesium citrate, I use this a lot with my migraine and acid reflux patients, as well as constipation. But for instance, in the research, it shows for migraines, we need to be looking at about 600 milligrams of citrate to effectively prevent migraines. Now, if the patient is coming in and you give them 600 milligrams of citrate and they're not used to it, they're going to probably end up with very loose stools, if not diarrhea. So we have to start small and titrate them up when we're looking at citrate. So I usually start in 150 or 200 milligrams and then titrate up to the 600 milligrams or whatever the amount is that I'm trying to do. And we do it slowly, and it's usually not an issue after that. So obviously, if you're doing constipation, you're wanting the softer stools and the looser bowel movements at the beginning, so you can usually dose that right at bedtime. And then we move on to magnesium bisglycinate, and this is a very popular form. It's one of my favorite. It can also be termed glycinate. So it can be magnesium bisglycinate, magnesium glycinate. They're both identically the same. It's great bioavailability, very minimal laxative effects, again, because it is attached to that amino acid glycine. And it contains 2 glycine molecules for every 1 magnesium molecule. So you're likely not going to get as much magnesium in a standard bisglycinate because the glycine molecules are fairly big. But we do know that glycine is calming, it supports detoxification, it's great with cellular functions. And it's also, the nice thing about magnesium bisglycinate is that it doesn't require stomach acid for its absorption because it passes into the cell via the amino acid transport. And so this means that those individuals with poor digestion or absorption can actually still get the benefits of magnesium even though they have absorption issues. So I often use it for those individuals as well. But like I said, it is a nice all-around form. And if you have patients that have multiple things, this is definitely one of the forms of magnesiums that I use. In clinical practice, chronic pain, anxiety, insomnia, stress reduction, and muscle relaxation are probably the big ones for magnesium bisglycinate. So then we move on to magnesium malate, and magnesium malate contains malic acid, which is also another amino acid. We know that malate plays a role in the energy cycle, so it has the ability to improve our ATP, which is our energy our energy currency in the body. So this form has been really studied extensively in fibromyalgia and chronic fatigue patients because it helps with relieving muscle pain, muscle tightness, and those trigger and tender points. Now, I also use this on athletes because malate has also been shown to improve exercise performance, muscle performance, and as well muscle tension. So it's a really great form to use with high-performing athletes or people who are doing long like marathons and like long periods of exercise. It's also well absorbed. It causes minimal digestive upset, if any, and usually does not result in any type of loose stool or anything like that. Then we have magnesium orotate. This is actually just starting to come onto the market more. It has more availability. It wasn't that easy to find a few years ago. It's starting to become a little easier. It's still not as obviously popular as citrate or bisglycinate. But orotate actually includes orotic acid, which is the natural substance that is involved in your body's construction of DNA. And so it's been studied specifically for heart health. And what they have found is that they are able to actually, the magnesium has been able to help the heart cells repair and improve their function. And so in clinical trials, they've improved heart failure with this, high blood pressure, angina, exercise performance, headaches, dizziness, those kinds of things. Again, this form of magnesium has good bioavailability, but I would say that this magnesium is very much directed towards heart health and heart issues, so especially the more severe heart issues. Then we have magnesium chloride, and Chloride is mostly used in topical formulations, so in magnesium oils, magnesium sprays. We often find this in trace minerals, liquid format, so alongside other minerals, obviously. We see that chloride can improve blood pressure, metabolic profiles, very good for insulin as well. It reduces our inflammatory markers like CRP. And there's been lots of research on this in anxiety and depression where they saw scores actually improve in like 6 weeks of giving chloride. This form is, again, not bound to an amino acid and therefore can very easily cause loose stool if given too much at one time without some type of titration. Most times trace minerals, when they're mixed together, that's not an issue, but sometimes we can see it on the topicals, especially if somebody has irritable bowel syndrome or an inflammatory bowel disease. They usually get a little bit of loose stool with that when just too much comes in at once. But chloride also has been shown to have some research to help increase stomach acid. So that's going to help to improve magnesium absorption. So even just giving the trace minerals with the chloride can help to absorb some of that magnesium. And then we have magnesium threonate, and this is another one of my favorites because it's the only form that can cross the blood-brain barrier. And this is a relatively new form of magnesium. It's much more available now than it was a few years ago, but this form can actually increase the number of neurotransmitter sites, which means an improvement in short and long-term memory. So what they did was in 2016, they did a study on elderly patients with early stages of dementia and who had significant cognitive impairment. And they dosed them the threonate for 12 weeks. And at the end of 12 weeks, they were able to see a reverse of brain age by an average of 9 years. And so they showed significant improvement in cognitive function in just 12 weeks. It's also really great for brain health and mood disorders. I use this for anxiety. So because magnesium also interacts with the GABA receptor, it's very good for anxiety patients. So I use a lot of this with depression and anxiety. And then we have magnesium sulfate, and this is not used in formulations, but is better known as Epsom salt. And I thought I would include it here because it actually has tons of research and actually can make your patient feel that much better. So it's a compound of sulfate and magnesium, and we know that sulfate has been shown to strengthen the walls of our digestive tract and also has detoxification properties, so it can release toxins. And we know that if someone just has an Epsom salt bath, it relaxes the nervous system. It's great for muscle and joint pain. We don't know how much magnesium is actually going into the system through transdermal, so through the skin, but we do know that it does go in, and it can also vary from individual to individual. So someone may have more absorption of transdermal where another person might have less. But regardless, it is definitely still a great form of magnesium to use, especially for stress reduction. 2 cups of magnesium Epsom salt in some hot water and 20 to 30 minutes in the tub is usually what I recommend. So this is probably the second most common question that I get is, how much do we dose? And magnesium dosing is really is difficult because, again, it's very individual. We need to look at the patient and we need to look at what are all the factors that could be causing magnesium deficiency in the system for that patient. What are their symptoms? What are the signs that could possibly direct us there? And then we dose according to that. And of course, sometimes in the literature, it gives us dosing. So for instance, like I said earlier, there's 600 milligrams was dosed for migraines. that is 600 milligrams, but if you're depleting magnesium with several other things, you may need to dose more. The recommended dietary allowance of magnesium is between 310 and 400 milligrams per day. This is the minimum that is necessary. And from my experience, many individuals require more than that. There are some that require less, and they are usually the very sensitive patients. So we start very low, and they usually don't need as much. But it's always, always really important to get patients to consult with their practitioner before starting any supplement, especially something like magnesium, because obviously if you take too much, you can have a lot of GI stuff. If you don't take enough, you're not going to get the therapeutic value. And if you're taking it around medication, we have to be careful there as well, because it can interfere with some medications, especially thyroid medication, which is often very common in the population, especially women's health. So dosing really depends on the individual's health concerns and their lifestyle factors. But you do probably want to start around the 310 to 400 milligrams per day. So now we're just going to touch quickly on food sources. And I know I said that, there's a decrease in the amount of nutrients in the soil, but that still doesn't mean that we don't want to include foods that are rich in magnesium. And I always get patients to include them into their daily diet. And so we'll just go over those. So leafy greens, spinach, kale, collard greens, turnip greens, all of your greens are great, not just for magnesium, but also calcium and other nutrients. Pumpkin seeds are probably your best bang for your buck. A quarter cup of pumpkin seeds equals 317 milligrams of magnesium. So you can see that that's getting almost to the recommended dietary allowance amount. So definitely pumpkin seeds are going to bump up magnesium. Flax seeds, avocados, nuts, Brazil, and almonds are the highest for magnesium. And then we have dark chocolate. Who doesn't love dark chocolate? But here the thing is it has to be 80% or higher to get a good therapeutic amount of magnesium from that. Fatty fish, so sardines, salmon, those are also rich in magnesium. And then some grains for those that can handle them, and that's quinoa and buckwheat. So those are kind of the foods that I make sure that patients are including into their food, into their diet daily, because this type of magnesium coming from these foods is different than the supplement form. And so we can actually take advantage of that. And finally, we're going to talk about the top health benefits of magnesium. And we know that magnesium deficiency is linked to numerous health conditions, and we know that supplementing with magnesium has shown positive outcomes. And I could go over lots of health benefits of magnesium, but I have chosen the most researched and the most common ones that we would see in practice or that are coming into our offices on a daily basis. So the first one we're going to start with is inflammation and chronic pain. And we know that inflammation, especially chronic low-grade inflammation, is usually the root cause of most chronic diseases today. So it's definitely something that we want to look at and control as much as we can. And magnesium is often overlooked when it comes to anti-inflammatories, in favor of, your fish oils and your turmeric and your boswellia, and that they're all great supplements as well. Don't get me wrong, but I always throw in some magnesium because we know, and the research has shown, that it has a potent impact on reducing inflammation. And we see that in the research, especially with individuals who have a CRP, which is the marker of inflammation, higher than 3. So if you have patients that have CRPs of 6, 7, 8, 9, or even higher, we see magnesium supplementation really beneficial in bringing those CRP levels down. And then, of course, with low levels of magnesium, we see this activation of, or an increased activation of white blood cells and the increased production of inflammatory cytokines, which are TNF-alpha and IL-6. as well as free radicals. And so magnesium deficiency actually indirectly enhances oxidative damage of the molecules by inducing a stress response. And then when that happens, our body stimulates this catecholamine release from the adrenal glands. And those catecholamines, so that would be like cortisol or adrenaline, they increase the production of these reactive oxygen species, and those are free radicals. And so this is how we see this inflammation start to happen. Now, we know pain is largely promoted by inflammation, and so dealing with inflammation can also help us deal with pain. And we also know that tight, tender muscles, trigger points, irritated nerve endings, these are all sending pain signals to the brain. And here's where magnesium plays that key role in regulating and relaxing the muscle and the nerve and improving nerve function. So it does the opposing effect of calcium in that it releases and it relaxes those muscle and nerve functions. So great supplement for helping with inflammation and chronic pain. Insulin resistance. This is almost another little, not little actually, epidemic in itself, with people being insulin resistant, whether they have diabetes or not. I see many people that come in that have insulin resistance, just haven't been diagnosed with type 2 diabetes. So it's definitely something that is commonly seen. But we also see that magnesium is deficient in those type 2 diabetics. And that is because they increase the loss through the urine, and then they also have low dietary intake. So we have to remember that high levels of insulin are going to deplete magnesium because it's going to be excreted out by the kidneys. And so if you have high insulin levels, you are going to lose more magnesium. And so these people, they could be supplementing or they could be taking in magnesium, but they're losing it as fast as they're bringing it in. And so that is an issue. We also see that it also is in low magnesium levels shows impaired insulin action, which then leads to insulin resistance, which then eventually leads to inflammation. So it's a vicious little circle that kind of keeps happening. But we do see from the research that magnesium has this special relationship with insulin, and it's that the receptors depend on magnesium for them to function and properly respond to insulin. So when we see the magnesium deficiency, those receptors are not working efficiently. And so in a study, actually there's quite a few studies that show taking a magnesium supplement for more than 4 months significantly improved insulin resistance. And this was in people with and without diabetes. So it doesn't matter if they're not a diabetic, it still gave significant improvement. And so we have to look at appropriate magnesium levels when we want to prevent metabolic syndrome. And metabolic syndrome is, I don't know about you, but I see this all the time in my practice. All right, so this is just a diagram that I wanted to show, and we can see that here's the low dietary magnesium intake. It's got impaired absorption, drugs, right? Medication, alcohol, genetic factors, maybe impaired renal function. These are all leading to this magnesium deficiency. But then we see what this magnesium deficiency is. So we talked about how it causes that low-grade inflammation. So increased oxidative stress, increased cytokines, increased circulating CRP. Right. And so from there, we can go back and forth, and it can also cause obesity, right? Because we know inflammation is the underlying root cause of a lot of these things. And then we see that going down to metabolic syndrome. And a magnesium deficiency over here shows the impaired insulin signaling because there's decreased intracellular magnesium, which can lead to type 2 diabetes or go back down to metabolic syndrome and type 2. So we see this as a complete cycle that happens over and over again unless we cut one of these issues. So we need to be dealing with this, and we need to make sure that magnesium is sufficient in our patients to stop this cycle. Okay, so it improves bone health and activates vitamin D, and this is really important as well. Remember, we said 50 to 60% of the magnesium is stored in the bones, and we need vitamin D as a component in bone health. And we also know that magnesium is necessary to convert vitamin D into its active form so that it can actually turn on calcium absorption. So we need adequate amounts of magnesium to absorb, metabolize, and distribute calcium. Now, where the problem comes in is when you take large amounts of vitamin D3, which is the active form of vitamin D, it does not activate in our body unless it goes through the liver by this enzyme here that needs magnesium. So a lot of people think, oh, just because I'm taking vitamin D3, it's active, it's going to be fine. I'm going to be able to activate this and I won't need to worry. There's a problem here. This enzyme requires magnesium. And so what happens is we obviously know vitamin D deficiency is large in the population as well. And we tend to tell people to take vitamin D, let's get you up to an optimal amount. But when you're taking these large amounts and you don't have enough magnesium in the system, like I said earlier, you can induce a magnesium deficiency or you can actually make it worse. But what you're also doing is you're intensifying the calcium. So the calcium is not getting absorbed because the magnesium isn't there to do that. And so what happens is, well, let me just back up a little bit. Magnesium's key role is in making sure that it prevents the accumulation of calcium in the cells, arteries, and joints, kind of like K2. And so when we don't have enough magnesium and you're taking all this vitamin D, you've got a lot of extra calcium happening, and that's starting to deposit into the kidneys and can result in kidney stones. It'll deposit in the joints and do calcifications, and as well as in the arteries. And so it's important that we make sure that if they're vitamin D deficient, they're likely vitamin or magnesium deficient. This is how we need to be thinking. We also know that when calcium is elevated in the blood, it's going to stimulate calcitonin. And in turn, that's going to turn off the secretion of the parathyroid hormone. And we know that both of these hormones regulate the levels of calcium in our bones and soft tissues. And both of these are related to osteoporosis and osteoarthritis. So there's something that we don't want. We don't want calcium elevated in the blood. And this is happening when we're bringing in too much vitamin D without the presence of enough magnesium. You can also use K2 to suppress some of that vitamin D, as they do have vitamin D3 and K2 together now for that very reason, but we still need magnesium in order to activate the vitamin D in the body. So they are a marriage made in heaven. Think of them like that. And of course, we see magnesium has been shown to slow the rate of bone turnover as well. And then we know that it improves sleep and reduces stress because of GABA levels. So it's going to help with calming the mood, improving sleep. It's going to help with restless leg syndrome. It's going to suppress cortisol and, of course, reduce oxidative damage. And then we also see that it downgrades the stress response because it is not producing as much cortisol. This is where magnesium has most of its study. This is what most people know magnesium does. So I'm sure that you'll be able to read that and go through that. But we know also magnesium improves hormones. So we see that we need it in the production of thyroid hormone. It helps us to convert from T4 to T3. It helps make our steroid hormones, progesterone, estrogen, testosterone. So that's going to be very helpful when we're dealing with menopause, migraines, PMS, anything hormone related. We know magnesium promotes sleep. And that is very crucial for hormone production because we see DHEA and growth hormone happening in good deep sleep and going through the sleep stages. And then we know that it also helps with our mood boosting hormone, serotonin, and then serotonin makes melatonin, which is then going to help with sleep. And one of the other important factors of magnesium is that it supports healthy estrogen clearance. So it supports the COMP enzyme in the liver. Without magnesium, that doesn't work properly. So it helps get rid of some of those metabolites, the hormone metabolites, estrogen metabolites, and thereby reduces the risk of estrogen excess conditions. We also know magnesium is really good in cardiovascular health. So low levels of magnesium show higher incidence of heart disease. It's very good at inflammation, vascular hardening, and very good at decreasing high blood pressure. So we see in the research and in patients that with magnesium supplementation, we can decrease systolic blood pressure by 3 to 4 millimeters of mercury on the systolic end, and diastolic by 2 to 3 millimeters of mercury. And so we also show that it improves blood vessel stiffness, which is obviously key for proper blood flow when it comes to cardiovascular function. And then finally, it improves digestive health and function. And we talked a lot about this already when we were going through the different forms, but we need magnesium for just the natural mechanics of digestion. So stomach acid, repairing and protecting our organs, the digestive organs, the esophagus, the stomach, the intestines, and we need it to make digestive enzymes so we can digest our food. It keeps our pancreas healthy. We also need it for bowel movements to expel wastes and toxins. And so we talked about magnesium citrate relieving constipation. And then I also talked to you about how it helps with acid reflux. So it just allows the lower esophageal sphincter to remain closed because if we have enough magnesium in the system, the food isn't going to have that delayed emptying in the stomach. And that is what causes that pressure to raise the lower esophageal sphincter. And so we talked about that when we did the citrate. And so that is the end of the presentation. So I want to thank you so much for being here and taking the time to learn all about this amazing mineral. We know that there is so much research with magnesium. There's over 12,000 publications on the PubMed database. So we know the efficacy and the safety and the therapeutic value of magnesium is big. And there is more than enough proof that supplementation with magnesium is necessary to improve a number of health conditions. And as Laura said earlier, this webinar was sponsored by Biogenna, and Biogenna commits itself to health and science, and their aim is to share knowledge with you all so that you can establish a basis for healthy lifestyles. And then I did put the references in here for you to review.